Our patient is a 48-year-old woman who's had several children, leaving her with a lot of extra hanging skin of her tummy. As you can see, there is quite a bit there. So the plan is to perform a tummy tuck to literally remove all the extra skin between her pubic area and to the belly button, remove all of that hanging stuff, trading it for a hip-to-hip scar and a little scar around her belly button. So let's head into the operating room and we'll also show you her markings before we get there. All right, here are the markings for surgery. We're going to make an incision that goes from hip to hip. We're going to lift everything all the way up to the bottom of her breastbone, tighten up the muscles on the inside, and the goal is to remove all of this, as well as do some liposuction of her hips. Surgery's all done. She did really well. You can see she has a hip-to-hip scar, and then a little scar around her belly button. She has one little drain. We're going to take that out within a week or so. And we took a lot of skin off her. I'm really excited to show her final results here in the next few months. Here's all the skin that we took off of her. It is just about 6 pounds worth. We're now 3 weeks out of her surgery and she is doing really, really well. As you can see, her tummy is nice and flat, but at 3 weeks she's still quite swollen. So we'll be excited as the swelling comes down to just show you just how flat she gets. Now that she's 3 weeks out, she can start exercising, and we'll get her out of her tight garments and get her back to normal life again. So with a tummy tuck, it's important to realize that the scars are permanent. They never completely disappear, and there's always a risk of thickening of the scars. And that really is the trade-off for doing a tummy tuck. Recovery typically takes about 2 to 3 weeks. Usually my patients at 2 weeks are feeling great, they're running errands or driving a car. 3 weeks to start exercising. And you can see with this patient, she is 3 weeks out of surgery. She's still a bit swollen. She's actually going to get flatter and flatter as time goes on. And that's the great thing. But it can take 4 to 6 months for all of that swelling to go away.